Alright, let's get back with the lecture because I know we're having so much fun. I want to take a break from the PowerPoint slides and just talk about some terminology that we'll be bringing up a lot in this class, and it's really important to have a really good understanding of the words we use because, to be totally honest, if you don't understand the words, you're not going to get the big concepts. And if you don't get the big concepts, you're not going to do good in this course or the program. And I want everyone to succeed. That's why I'm here. That's why I'm doing these things. I want you to succeed. But we have to be able to understand how to talk. So let's just talk about a few of the keywords, and I'll be going over a bunch of these over the next couple portions of this lecture. But I just want to get a few of them that we've kind of already touched on so far. We talked about a number of things, but early on we mentioned recently talking about those fentanyl patches, because you have to wear gloves before you touch them, and remember how people would steal them off and chew them and get that big burst of fentanyl, and that's really gross and disgusting. But the word that we're looking at there is called absorption, and the technical we all know what it means to absorb, right? To draw up, to pick up. But the technical term of absorption is the process by which a drug passes from the site of administration into the fluids of the body. So if you think of a sponge absorbing water, that's kind of what we're talking about here, but it's more specific when we're looking at pharmacology. In this case, whether we take a pill or an inhaled medication for like asthma, or a nasal steroid, or a shot. I like to use body language when I talk, so you'll see my hands. I'm doing a lot of stuff. But no matter how we take the medication, until that medicine goes into our tissues, it doesn't do anything. So that movement into the tissues and into the fluids of our body, that's absorption. Why is it important? Because every type of medication, every route, has a different rate of absorption. What do you suppose the fastest absorption is? IV. Goes right in, boom, it's there. Think of a pill. You take a pill, you have to swallow it. It goes into the stomach and it starts to dissolve, and then slowly gets absorbed into the tissues. So that's slower. The transdermal, that fentanyl patch, and there's many other medications that are given transdermal or through the skin. That absorbs slowly through the tissues and then gets into the fluids of the body. Suppositories, rectal suppositories, same thing. They slowly melt and dissolve and get absorbed into the tissues. Every medication has a different rate of absorption, and that rate will depend on how long that medication works. If it's absorbed quickly, it's going to get used up fast. IV medication kicks in really quick, and then it goes away quick. The transdermal moves slowly, but it lasts longer. So that's one word. Let's talk about bioavailability. Bioavailability. And what that means, this is related to absorption. This is the term that quantifies the extent of absorption. So sometimes you can take a medication orally, but your body can't use it all. Let's look at vitamins for an example here. Some people take very large doses of vitamins, but our body can only absorb a certain amount, and that's going to be different for everybody. But let's say you take 1,000 units of a vitamin. If your body can only absorb 500 units, you have a bioavailability of 500 units. The rest of it gets excreted. So bioavailability relates to how much of the medication will be absorbed. Okay, so we have absorption, where the medication is drawn into the body's fluids, and the bioavailability is the amount of absorption that can happen. We talked about how the body gets rid of those medications, and that's elimination. Specifically, the process by which drugs are removed from the body. We're going to get into this a little bit further in greater detail, but the process uses just a few different routes. It uses the renal system or the kidneys, the hepatic system or the liver. It can also be excreted through the skin, through sweat, and that's about it. But most of it is going to be through the kidneys and the liver. So it's renal excretion or hepatic excretion. And you need to know which route, because some medications will affect the liver or the kidneys, but usually not both. So, if you have, let's say you have kidney disease, and you take a medication that is excreted through the kidneys, what's that going to do? Let's think about that. If you have kidney disease where your kidneys do not function properly, and you take a medication that is excreted through the kidneys, it's going to linger in your system longer. So it's going to be in your system for a lot longer than it normally would. So doctors would probably prescribe something that would be hepatically excreted. Likewise, if you have liver damage and liver failure, you're not going to give more medication that would be excreted primarily through the liver. A common medication that's excreted from the liver: Tylenol, acetaminophen. And so if you have a condition where there's already liver damage, you're not going to give a medication that can cause more liver damage, right? So we've got absorption, where the medication, the drug, is absorbed into the body fluids. Bioavailability is how much of that available medication can actually be absorbed. Elimination is how the body gets rid of it. But now let's look at two more terms. When that medication is in the system, there's a number of things that can happen. You can get a therapeutic effect. And a therapeutic effect is simply the intended or desired effect of a particular medication. So let's look at Coumadin or warfarin. Warfarin is a medication that prevents the blood from clotting. So the therapeutic effect of warfarin would be you'd have a prolonged PT-INR, which is a lab test that we'll talk about a little bit later. But your blood will not clot as quickly. That's good. So the therapeutic effect is your intended effect. Morphine. If you take morphine or hydrocodone or Tylenol, any of those, the therapeutic effect is reduction of pain. Right? So let's look at morphine. You'll give a lot of morphine in the hospitals, especially in acute care settings. Morphine is a very potent painkiller. So the therapeutic effect is to reduce pain. Now, are there any other effects that can happen? Yes. And that goes back to that elimination. If the medication is not eliminated quick enough, you have a greater tendency of having other effects beyond therapeutic. You could have side effects. Now, side effects are not necessarily terrible. They are generally undesired, but they're usually predictable as a pharmacological effect of a drug. Again, talking about morphine. The therapeutic effect, the intended effect, is pain reduction. A side effect could be what? Sedation. Very drowsy. Now, that may not be desired, but it's predictable. You give a person a painkiller, almost always the first thing is pain relief. Yay! And then if you give them either a little too much or it stays in the system a little too long, you get drowsy. Not necessarily a bad thing, but it's not the desired effect. Okay? There's a difference between bad and undesired. Undesired is just not the intended consequence, but it's kind of like what you take, or what comes along, the baggage that comes with the medication. Pain relief, and you get drowsy. It's usually not a problem. But we can go one step further, and we get toxic effects. And a toxic effect is an effect that caused by a drug that can result in poisonous injury to a client. Again, looking at morphine. If you give a person too much morphine, first the pain is controlled, right? Then they get drowsy. And then their breathing slows far too slow. That's a toxic effect. That's bad. You do not want toxic effects. Tylenol. If you have a fever, you take 2 tablets of Tylenol, 325 milligrams each, or 650 milligrams total. You take your Tylenol, the fever goes away. Therapeutic effect. If you take way too much Tylenol, you will damage your liver. That's a toxic effect. Okay? So we have therapeutic, side effects, and toxic effects. 3 different levels. None of these are allergic reactions. Okay? I want to make sure that's real clear. Side effects and toxic effects are not allergic reactions. They are expected consequences of a specific dose. Not always desired, but predictable. If you give too much morphine, the person will get drowsy, their breathing will slow down. It's predictable. Not desired, but predictable. An allergic reaction is an unpredictable reaction. An allergic reaction, an allergic response is something that you have no warning. It just, boom, happens. What are some allergic reactions? Well, the classic ones that you really need to take note of are itching, hives, a rash, especially an itchy rash. So itchiness, a rash, hives, those are bad. Those signal that there's an allergic reaction happening in the body to generally that drug that was just taken. There's one further level of allergic reaction, and that's called anaphylaxis, or anaphylactic shock. An anaphylactic shock is the most severe allergic response possible. This is when the breathing becomes difficult and respiratory collapse and circulatory collapse happens. In other words, this generally swelling in the throat happens so bad that they can't breathe, or their blood pressure drops so low that their heart can't perfuse, and the person will quickly move from life to death. So people they use a medication to counteract that. Do you know what medication they use? We'll talk about that in class. What medication is used to treat an anaphylactic reaction? And if you need it now. Not later. Now. Okay, so what have we covered so far? Absorption is the movement of the drug from the drug form into the body's fluids through the tissues. Bioavailability is how much of the medication can be absorbed. Elimination is the body's way of getting rid of either the pure medication or a metabolite of that medication. Sometimes medications are converted before they are excreted, but that's elimination. While the medication is in the body, you will get first a therapeutic effect. That's what you want. That's the goal of the medication. For warfarin, reduced clotting ability. For acetaminophen, pain reduction, fever reduction. If that medication stays in the body too long, or too much is given, you might develop undesired but predictable side effects. These are effects that, again, we don't really want, but are pretty common to see. person who takes warfarin, what do you suppose a common side effect is? Bruising. Bruising. A person will bruise very easily on warfarin. That's not what we want, but it's predictable. And we tell people in advance, be careful. You are going to be prone to bruise while you use this medication. Undesired, but predictable. And I'm pounding these definitions in because they're so important to understand. After therapeutic effect, we have the side effects, and after side effects, we have toxic effects. And that's where the person is becoming poisoned by the medication. Another medication for the heart called digoxin. That's used to slow and strengthen the heartbeat. Too much medication, the heart slows way too slow, and then a person becomes toxically affected. They have a toxic level of digoxin in their body. So toxic effects are poisonous effects, and those you want to avoid whenever possible. There are allergic reactions which are unpredictable reactions that come on suddenly, seemingly out of nowhere. Itchiness, hives, a rash. Here's a perfect example. And something else. It's almost never the first time you use the medication. See, the first time you take a medication, you are sensitizing your body, and it's the second or third or fourth time when finally your body says, that's it, we give up. We can't handle this medication, and that's when you get a reaction. I had a really bad sinus infection one time. My doctor gave me a very good antibiotic called Biaxin. That's a brand name. And I took it the first day, no problem. The second day, I noticed right here in the middle of my chest, it's a little patch of a rash. And it itched a little bit, not bad. And I didn't think a whole lot about it. So the second day I took it, or the third day I noticed the patch is now like this, and it's itching a lot. Now, most people at this point would realize that there's a problem, but me, being who I am, on the fourth day I take it again, and by that night, my entire torso is covered with the rash, and I realize allergic reaction. I call my doctor, tell them I have a body-wide rash, and they said stop taking it. Now I have Biaxin as an allergy on my medical chart. By the way, I was a nurse at the time. I was a nurse for probably 12 or 13 years at the time, so I probably should have known better, but you know. So sue me. So that's an allergic reaction. It comes on out of nowhere because it's like the second or third day before anything happened. One step further in the allergic reaction process is anaphylaxis, and that's when the swelling gets so bad. It can be mouth, tongue, epiglottis, the larynx, but it will swell shut to the point where breathing is compromised or stopped, or circulatory collapse from a drastic drop of blood pressure. Either way, you need immediate reaction, immediate treatment, or death will happen. So we've covered some of the medication terms. We're going to be going over more, but I just want to give you this much right now. And come on back for, I think we're going to be on, I think this is part 4. Come back to part 5.